I'm Algenon Cash, and you're locked in. Today, we're talking about the people who feel the American dream has become a living nightmare. Families juggling rent, power bills, prescriptions, and groceries while programs they rely on hang in the balance. Between cutbacks to the Affordable Care Act and interruptions to SNAP, a government shutdown isn't an abstract debate. It's empty fridges and overdue notices. To help us see the front line clearly, I'm honored to be joined by Margaret Elliott, Executive Director of Crisis Control Ministries. Her team stands in the gap every day, keeping lights on, medications filled, and families stable. While demand surges and dollars don't stretch like they used to, we're going to talk about what Margaret's seeing right now, the toughest pressure points, rent, utilities, and food, and what practical steps our community can take this week to keep our neighbors afloat. Let's get into it, Margaret. Thank you for locking in. Thank you for joining us. I wish it was under better circumstances.
Amen. But thank you for having me.
Well, you and I have known each other actually for many years, but we sort of got reconnected this year because we had a chance to
Mhm.
work with you on the Hope du Jour program through our Eat Drink Triad platform, and that was really great work. And you all do really, really great work at Crisis Control. So let's start there because I think some people, if they haven't come into contact with you all, maybe if they've been had to use you all or they haven't made a donation to Crisis Control,
Mhm.
they may be unfamiliar with the great work you're doing in our community. So maybe just give us a little context about the services and the work you do there at Crisis Control.
Sure. So we are an emergency assistance provider. And that means for us that we are providing for someone's basic life needs, defined for us again as being help with food, financial assistance to help get someone in affordable housing and keep them in affordable housing, and to help pay those utility bills, stay warm in the winter and cool in the summer. And also, we have a free pharmacy and a Medicaid provider pharmacy. It's one and the same now. We're hybrid pharmacy. And our food pantry is the first client choice food pantry in Forsyth County. We've had a food pantry the whole time we've existed. We're 52 years old, but we've moved from just having boxes filled and giving them to people to now a miniature grocery store look, and a 2 week supply of food is provided to families regardless of family size. So in a nutshell, that's what we do, in addition to some poverty awareness programs that we provide across the county and the region.
Well, I had the opportunity to come visit with you a little earlier in the year and tour the facility and see the pantry, which actually looks like a little mini Whole Foods, quite honestly.
Mm-hmm.
And for people that are unfamiliar with Crisis Control Ministries, I'm telling you, if you can carve out an hour or two to go down and just see firsthand the kind of work that they do, I think that's really interesting. And it sort of showcases how the way you provide emergency assistance has really evolved over time. So you're not just giving out boxes of food, but really allowing for your constituents to have that choice. Talk a little bit more about that, Margaret. How important is it for people to feel like they have that autonomy and that sort of free will when they come into your facility?
I think it's very important. I think, as I often say, it adds dignity to the process of getting food. You're in a food pantry, but you don't feel like you're in a food pantry. And I think that makes a big difference. Our food pantry manager, Tanya Hairston, told a story the other day about a woman who came in there and her son called her on the phone, and she picked up and she said, "Son, I can't talk to you now. I'm at the grocery store." And it just brought tears to Tanya's eyes because it just kind of reiterated the fact that that's what we want people to feel like, is that they're in a grocery store and that they're picking the food that their family will actually eat, not just you know taking food that someone else might get them. I mean, that's nice, but I really think it adds dignity to the process of getting food when you have your own choice.
Some of the products I saw in your pantry, where does some of that come from? I mean, it's some of the same products you would see in a Whole Foods or a Publix
Oh,
or other grocery
for
store.
sure. So we partner with about 8 or 9 different grocery stores. We have donations from individuals, from congregations, from businesses, people that do food drives for us. So the food comes from lots of different sources. Some local restaurants give us food. We get soup from Olive Garden, for example. And a lot of times, we'll freeze that and give it to the soup kitchen. We share all around. If we don't move it, we get it moved. So um, we have fresh fruit and vegetables. We partner with Trader Joe's. We have meats. I mean, sometimes we have filet mignon and lobster in the meat, compartment. There's 9 different sections in the meat row. And of course, the kind of typical canned food stuff, but we also add a lot of breakfast items into a food order so that children, who comprise about 40% of the people served in our food pantry, have a good breakfast to start the school day off.
Well, right now, and specifically this week, food insecurity is at the front of everybody's minds during this government shutdown that has been going on for the past several weeks. Feels like right now, Washington really controls whatever the news cycle is. And so this is the latest, greatest emergency happening in Washington. So everybody across the country right now is focused on food insecurity. So you're at the front line, Margaret. I mean, what are you seeing right now in terms of the number of families that are turning to your pantry? I mean, how many people are coming in there?
Well, it has been probably for the last 2 weeks since the conversation has started about the possibility of the shutdown continuing and folks losing their food stamps as of November 1st. We've seen a tremendous increase in the number of people coming just in case it continued on. And unfortunately, it has continued on. So, I do not know the numbers right this second, but, we might see 10 or 15 families. We've probably seen 30 families. So it's almost doubled in terms of the number of people that are coming into the food pantry every day. So, right now we're able to provide the same 2-week supply of food. Our goal is to continue to provide the same amount of food that we always provide. Having said that, maybe kind of tough to do that. I know another coworker said that he was working really hard last week to keep the food pantry stocked from our warehouse into the food pantry. He just couldn't keep it stocked fast enough for the people that were coming in. So it's it is going to be a difficult time if this continues on for a long period of time, because we cannot make up the difference that the federal government and the SNAP program makes up. There's no way. I mean, that's been in the news as well. We're just one food pantry, but Second Harvest Food Bank can't make up the difference either, and they've said the same. So it's a big problem.
So, like the families that might need to utilize your pantry, what's the process to be able to do that? Do you just show up, or you have to get pre-approved to be able to use the pantry, or?
Either you can show up and there is an interview process. For food, it is not an extensive interview. It's just basically give us information about your income and expenses and tell us your story about why it is that you cannot afford your food. For a lot of people, it'll just be, I usually get $797 worth of food stamps, and this month it's been cut off. I was supposed to get them today. I didn't get them. I don't have food for my family. So, that's a pretty easy conversation and an easy yes. So it's just we get demographic information, and then they're shown into our food pantry where they can do their shopping, and then bring a car around, and we'll help load it into the car or whatever vehicle they have.
And with the debate that's happening in Washington around the SNAP benefits, if the government shutdown was to continue on through November, does that impact the actual food and the resources that are available at the pantry, or how does that impact crisis control specifically?
Well, I think we do get some food from the Second Harvest Food Bank. They received a $3 million cut for a certain. I don't know all the details, but it had a lot of fresh fruits and vegetables that was part of that program that they no longer are able to get. I do know that they're working really hard to try to find alternative sources and to try to find other places where they can purchase food, but they took a $3 million hit pretty quickly early on in the process. So I think for the rest of us, it's just going to be as long as we can keep the food supplied in our food pantries, we will provide it. I have heard of some other food pantries who are right now cutting back what they give, just so that they can kind of keep, a little bit in supply so that maybe it'll last a little longer. We're trying not to do that right now, but just don't know. It'll just depend on how much food goes out the door and how much food is left. So, we love our community, and our community is a very gracious one, so that we know if we ask for food donations, we'll get them, or for some money to buy food. We can probably buy it a little bit better in bulk than someone at home. But it's going to take all of us to try to help. There's a lot of ways that people are reaching out and trying to help. Um, it still will not equal the amount of food and the money that would come from the food stamp program, SNAP program.
If you're just now joining the conversation, my name is Algenon Cash, and of course, you're locked in. The other voice that you hear with me today is Margaret Elliott, who's the executive director of Crisis Control Ministries, and we're just talking about this ongoing crisis, not only here in Winston-Salem, North Carolina, but right now across our country related to food insecurity and the ongoing government shutdown in Washington, D.C. Margaret, a lot of our conversation has been more about some of the SNAP recipients, but I, my thought is that you probably service a lot of different types of people, people that might not necessarily even just be on SNAP, but perhaps they're somewhere in that gap
Yeah.
of not just having enough money to take care of their necessities and running out of whatever the resource is. Talk a little bit about the types of families and individuals that utilize crisis control.
Yeah, I'm asked sometimes who's the typical family at crisis control, and there's not a good answer to that because we serve anybody and everybody that comes here. We do have a lot of women and women with children who come to crisis control. So again, especially when it comes to the food part, 40% of the folks in our food pantry are children. But as families, it's older adults, it's people who are getting their free prescriptions from us at our free pharmacy who walk right by the food pantry and say, "Hey, I also need food." So they become what we call certified clients, so they get both pharmacy and food service here, kind of automatically. But it's families, it's individuals. I will say the families are, it is mostly mothers with children.
The more recent debate is centered around the temporary halt in SNAP benefits, but some of the more recent inflation reports right now that are starting to come out are showing that the cost of food across the board for everybody is really starting to skyrocket.
Mhm.
And we think this has a lot to do with the president's policies around tariffs and how that's starting to hurt our food industry amongst just a number of other things that seem to be going on in the economy that's driving the price of food to go up. I think I heard a report in the New York Times this morning that right now the average family is spending $1,000 more per year compared to last year on just
Wow.
their food. That doesn't
Mhm.
have anything to do with their the jump in their utility costs and rent and mortgage and
Right.
some of the other things that are going on right now. So, how has some of the inflation in groceries just changed the way you guys operate? And has even prior to the halt and SNAP benefits, were you just seeing more families coming in just because of the inflation in food prices?
We have a good number of families, more than 5,000. I'm looking at my statistics, but more than 15,000 people were assisted with food assistance in our one pharmacy here last year. Um, it is something that we pay attention to. We try to wheel and deal the best we can to try to buy food and groceries at good prices in bulk the best we can. But yes, my coworkers who do that purchasing will often come up and say groceries are going to be a lot higher this year. We might need to ask the board to raise the budget a little bit, and we did. We went from 60 some thousand to 90,000 last year. So, it was a huge increase, and that was last year. So, um, it's just amazing to see the prices. I mean, we're very fortunate again that we get good donations from about 8 or 9 different grocery stores and from local restaurants. But there are some things that aren't donated so that we purchase because we give out about 87, 88 items in every food order, including some household products that you cannot get with food stamps. And so we try to keep the same number of items in every food package. So some of those things we have to purchase. So again, it has increased our budget as a nonprofit in the food category. So that's how it's impacting us right now.
Margaret, we have the holiday season coming up here, be Thanksgiving here in about 3 more weeks, and then shortly after that, we'll be in Christmas season. Um, you've been with Crisis Control Ministries for many, many years, so you've worked many different holiday seasons. With everything you and I are talking about today, this conversation that we're having today, how does that start to impact or have some kind of influence on what's going on with your constituents in the holiday season?
Well, even we get about 60 to 70% of our donations, food donations and financial donations in these last 3 months, October, November, December, into January a little bit. So it's a very important time of year for us in terms of donations, and also, of course, in terms of the food that's distributed and the money that's distributed to people to help pay their rent and utility bills as well, and of course, pharmacy too. So I think to answer your question, it does feel like it's the time of year where people are feeling, a little more charitable. I think that what we do here in terms of providing for someone's basic life needs kind of sends a signal that's what we do, and that is to me the most important thing that we do, and I or the most important thing that we can do in a community is make sure that people's basic life needs are provided for. And so, we've got the food crisis right now with the SNAP benefits and all that. But people are the rent's going up as well. That was kind of the big thing last year, and it's continuing into this year. Utilities going up a little bit. So it's just overall, I feel like this is, I love the season of Thanksgiving, and I love the season of, I just love the whole idea of just the gratitude that we feel at this time of year. But it is really going to be showcased this year because we're going to need it.
When you talk to some of your colleagues around the state of North Carolina, and North Carolina is an interesting state because about just around 95% of the state is pretty rural, and then you've got around five counties that happen to be more urban-based counties. But what's the chatter from some of your colleagues in other communities in North Carolina?
Well, especially in the rural community, getting food out to the rural areas is always a difficult process. I mean, food banks have delivery trucks and that kind of stuff, but it's just more difficult for people to get out and about and get their food. So, we're in more of the urban areas here, but we still serve some rural, areas. So, it's just going to be important again that we somehow figure out how to get food to people especially if they're in outlying areas. I mean, that's a very good point.
Yeah. Well, to my audience, if you find it in your heart, this might be the year. If you're able to make a donation, whether it be to Crisis Control Ministry or if you happen to be listening to this conversation in some other community across North Carolina or outside of North Carolina, certainly look up your local food pantry, and I'm certain they could use your help, not only in terms of your treasure, but I think they could also probably use your time in terms of
Volunteers.
volunteering, and also just any talent and connections you might have to generate more donations for that pantry. So this is the certainly a year we should be thinking more about others and our neighbors more than ourselves if we happen to be in that position. So, Margaret, you mentioned just a moment ago you talked about rent inflation, and North Carolina has really been sort of the tale of two cities here because last 4 or 5 years we've been voted number one state to do business in. I mean, literally consecutively. And you have all these companies that are moving into town, and just right here in the Triad alone, we've been able to create 20,000 jobs. And so, as you get more people moving in the region, those people are looking for housing. You see the price of housing continue to going up because the demand is so strong. So it's really creating this bifurcation where you've got one group of people that are really struggling to try to keep up, and then you got another group of people that are moving in, and they actually think the houses are cheap. So in your day-to-day walk and some of the folks that you're serving in over the last few years, how have you seen the housing inflation impacting some of your families?
There's just not enough affordable housing for folks. When I came, I've been in crisis control for 26 years, and kind of the average rent when I first moved in, we were writing checks for $300-400 to help people stay in and get in and stay in affordable housing. Now our checks are 1,000, 1,200, 1,100. I mean, a lot of the checks are more than my mortgage payment that we're paying for rent for folks. So it's amazing the increase in the housing costs, and unfortunately, the lack of affordable housing is really impacting. I mean, I think that's gonna the rise in unhoused people in our area. It really is kind of the tale of it's I liked how you said that kind of dichotomy. We've got folks that are, can't even find housing to live in, as opposed to people that really kind of want to move here because they think we're a cheap place to live. But some of those, they can afford some of those houses, but the folks that come to crisis control can't. So, and there are some groups, really good groups out in the community right now working to try to remedy that and to try to come up with alternatives to provide affordable housing, but that will take some time. But I hope we're on a good path there.
Yeah, no, there's a lot of groups around town that have
Mhm.
been working and talking about this initiative for the past several years. I would love to say that we're making more progress, but it just feels like we've still been stuck on the issue for many years now. With
Yeah.
some of the families that you talk to day, I mean, these might be people that, folks in my audience might not get a chance to hear from and engage with as frequently and often as you do. But talk a little bit about how just the overall just having that stable housing, how does that contribute to the overall well-being of some of these families?
Well, I mean, if you have stable housing, then you feel safe. You have a place for your children. Your children feel safe. It's just like any of the rest of us. Anybody. If you have stable housing, you have a place to go home to. And so it's terrible to have to worry if that you're not going to be able to pay the rent the next month, and you might not have that house, and you might not know of any other place to go, and people can't tell you where else to go. It's a very scary feeling. So stable housing to me is one of the most important factors for our families here at Crisis Control, that they have housing, that they can provide for the basic life needs for their whole family, which is what is the goal for all of us.
With some of the other cuts that are coming out of the federal government, especially with the president's domestic policy bill that passed a couple months ago, it does appear there's going to be some Medicaid cuts, or there are some Medicaid cuts in place, which means there's going to be some changes to health insurance here in North Carolina. With
Mm-hmm.
some of those cuts in the ACA or the Affordable Care Act, is that having any negative implications on crisis control and, of course, the families that you serve through your prescription drug program?
Yeah, I mean, we haven't gotten there yet because I guess those decisions haven't yet been made, but the anticipation is that those who are enrolled in Medicaid right now may not qualify. So they may go back to being uninsured. For us, it would just mean, we get reimbursed right now from Medicaid for our Medicaid patients. And that's a relatively new group that we've been working with for the past year and a half, but it's helping to pay for some of the prescriptions that we buy. But if they go off of Medicaid, then they go back to being uninsured folks for whom we pay for their medicine. So it will impact our organization. We hope to be able to still provide the medication for them, but it's just going to be more expensive for us to do so. And not as and just the number of people that have just been insured finally with Medicaid expansion that happened just in 2023, for that to go away and or to have a work requirement that you may or may not be able to do, it's just going to make life more difficult. And for many of our families, the least little thing to make your life more difficult is just making your whole life just that much harder to get by.
Well, it's also sounding like it just might be hard to keep up.
Seriously, yeah,
If these things are changing so rapidly over, short periods of time,
yeah.
a lot of times the constituents that these programs service, a lot of times these are not the people that are most engaged and up to speed with what's going on with public policy, and it just sounds like they're being whipsawed all over the place here. And so that's and also listening to you, I mean, we're talking about food, we're talking about rent, we're talking about
All of it.
healthcare, we're
Yeah.
talking about some really, really big issues. So, I mean, when you have these families come into your office, I mean, what kind of trade-offs are they being forced to make? I mean, between what, food and taking
Food and
care of your body? I
medicine.
mean,
I mean, again, when I came here, a long time ago, the question was, we're so happy to say that we have a pharmacy because we said now people don't have to choose between food and medicine. And so we're back again at saying, people are having to choose between food and medicine. I mean, we're trying our best to make it so that they don't have to make that choice if they come here. But there are so many people in the community who may not know about us, who are still having to make those choices between you know things that we all need. You need your medicine to live, and you need your food to live too. So not a choice that any of us should have to make.
Well, here's my
And food
last
should
question
not be a
for you. I mean,
political sport.
every now and then I do have some federal or state policymakers who actually do listen to the show. I don't know if they listen to anything I tell them to do, but they do listen to the show.
Yeah.
And if there's any chance that there are any policymakers that might be listening right now, what would you want them to understand about the real world impact of some of their decisions?
Well, that food. I know that there are food policies, but the provision of food to families should not be a political issue that causes people to, stay up at night worrying if they're gonna wake up in the morning and be able to go to the grocery store because they just don't have any, they don't have any money to pay for their food for their children. We all can help. We're in a very supportive community, a lot of supporting communities out there, but we just cannot make up the difference that these government programs are providing. So we need the government programs to provide the food that they're intended to serve people, and I would just say that's doing their job is to make sure those policies stay in place.
Margaret, thank you for joining me. And to my audience, if this conversation moved you, translate it into action. Donate to Crisis Control Ministries. Every dollar helps a neighbor stay housed, keep the lights on, and put dinner on the table. Give what you can, organize a workplace drive, volunteer, do whatever you can. It all matters and it certainly counts. And if you value conversations like this, grounded, local, solutions oriented discussions, please support my content, share this episode, subscribe. You can even chip in to help me keep producing independent conversations that strengthen our community. Just get in touch with me to ask how you go about making a donation. But the most important thing, make sure you stay tuned to WTOB because every Sunday morning, that's where you can lock in with me. But if you happen to miss me there, hopefully you're subscribed to the podcast. You can get that on Spotify, Pandora, YouTube, Apple, wherever you like to get your favorite podcast. You can always lock in there. And until next time, y'all stay locked in.